Good morning, everyone. Thank you for coming to part 2 of Focus on Healthy Function. I'm excited you're here. We have some things to talk about today. I know we're in a time where it's questionable what you should do or should not do. There's a lot of fear going around. There's a lot of questioning on, how do I take charge of what I need to do for myself and my family? But please remember, we talked about this last time. Your body is brilliant. It knows what to do. And if you give it what it needs, it's going to respond in the way that it was designed to respond. Now, last time we talked about diet, digestion, and bowel elimination formulas. We talked about the need for the body to have energy so the brain could be focused, so it can listen to the heart, so the person that you're trying to help can do what they love. We talked about how to use those adjunct dietary formulas, how to supplement when your diet is not adequate enough. We also talked about using digestive enzymes and the different use of the different products we have to address digestion. And then we talked about helping the body bowels and all of that accumulates as toxicity. Well, today we're going to talk about the immune system. But one thing we don't think about with the immune system are there are 4 independent defense systems that surround, interconnect on many different levels with the immune system. For example, angiogenesis. Angiogenesis is the growth of blood cells. Now, last time I talked about the metabolic priority sequence, and where the most blood supply occurs, that's where the most metabolism occurs. And you have foods that will help the growth of blood vessels when they're needed. You have foods that will interfere with it. So you have more of an ischemic or lack of blood supply to that area. So that area is not getting what it needs. You also have a DNA modification. So what does that mean? You have certain genes that turn good processes on in the body, and you have certain genes that create things to grow or disseminate in the body that should not occur. So the question is, are you feeding into your genetic strength or your genetic weaknesses? That's big. So look at another aspect of a defense system is regeneration with stem cells. Remember, all cells have a desire to live, and it will reproduce themselves when they're depleted. We are constantly growing and changing. So are we feeding into our bodies so that the stem cells will grow in a way that is in line with healthy function? Or are we pushing our bodies down the road to conditions that go far beyond what we're able to treat with nutrition? And then we have to look at the microbiome. Really, we're 50% human cells and we're 50% microbiome. And that flora, and we talked about that with the formula we mentioned last time, the SMI formula, about the importance of building our microbiome. So now, today, we are going to talk about the use of enzymes. Remember, enzymes require 4 things to function. They need a correct pH. They need something to work on. They need the right temperature. They need water. So hydrolytic enzymes. So when we think about hydrolytic enzymes, when we think about the immune system, the white blood cells, the macrophages, the neutrophils, all of those enzymes are in lysosomes within those cells. Enzymes do not have an intelligence, but the body does. The body has an intelligence. The body knows what to do with those enzymes. And so we're using supplemental enzymes, and we're going to talk about vascular. We talked about it last time as a digestive formula. Today we're going to talk about it as an adjunct supportive formula to support healthy function of the immune system. Now you have what we call autointoxication. Autointoxication is really the part of the immune system that is immediately responsible for what the body needs to correct. So when things are getting across the gut lining, so we got all the way through to the digestive system last time and the bowels. Now that's really outside the body. Now when things start to cross that gut lining, that's where your immune system starts to align that. It aligns the gut lining, but that's where your immune system starts to have its immediate response to what doesn't belong in the body. So things that should get across are getting across, things that are not completely digested, that maybe have created some kind of irritation in that lining, those things can create more gaps in the absorbability that's going across that gut. So things are getting in that they shouldn't get in. So when we think about what's getting in, okay, we're looking at macronutrients, carbohydrates, proteins, fats, along with minerals and vitamins. So those big molecules, if they're not in the size, and I know we talked about that, it's important that they have to be in the right size for the body to utilize them. If they're not, then you can engage your immune system. Now, things that cross the gut lining either go into the portal vein, into the liver, or they go into the lymphatics. Those are the bigger molecules that go into your lymphatic system, and they'll take it to the liver. And we're going to talk about the liver and the organs that support the immune system as we go through these products. But the first one here, vascular, we call it vascular, VSCLR. We used it as a digestive last time. We talked about it with people that have fat issues that need the extra lipase to break things down. If you look at the formula, it also is a formula that can be used for helping the circulatory system, because fat will get into the circulatory system, and so will enzymes. And enzymes are needed to break down fat. This particular formula can be taken between meals. You could take 2 or 3. Usually the bottle recommends 2. But if you use your clinical judgment and your clinical objective findings, you can decide if the body needs more or not. That's completely up to you. This particular formula, lipase, picks up chloride. In fact, it uses chloride as a cofactor. So if your body has been progressing for a long time, the body will become more acidic. So lipase is a great enzyme that's used in this formula to help the body's immune system and healthy function supply enzymes to the blood cells, the white blood cells. That's where your force is. That's where your force is with autointoxications. It's with those white blood cells that use enzymes. So again, we are using enzymes to support healthy function. We're not using enzymes to treat a condition. So remember that. And it's a good thing to remember when we're talking about supporting healthy function. If your person has a chronic condition, we are not treating that. A chronic condition should be something that should be referred to your medical provider for further evaluation. We don't treat anything that's chronic. We don't treat symptoms. We supply the body with nutrients to support healthy function, and certainly healthy function of the white blood cells that use enzymes know what to do with them. So let's look at vascular for a second. VSCLR, we talked about it being used as a digestive last time. So when it's used as a digestive, it's breaking down fat. Now, what happens when your immune system needs support? You can use it as a digestive. You can use it with a formula called SPL, which we're going to talk about shortly. And I'll talk about it when we get to it. And that would be something that you would use at the end of the meal. And we're going to talk about a formula called TRMA, which is a proteolytic formula. So I'm giving you a protocol to support the healthy function of your immune system It's just a general protocol. Two vascular to help you digest your food, 2 of the SPL to help you oxygenate your blood, and 4 of the TRMA, which we'll talk about shortly, to help your white blood cells that also use a lot of protease. So that formula, VSCLR, can be used with maybe the Bill formula if you're using VSCLR between meals. Now let me review between meals. Between meals is either an hour before you eat or 2 hours after you eat. That's a golden rule for between meals because you want to take it at a time when you're not using those enzymes to digest your food, but you're using a window of opportunity for those enzymes to be absorbed and utilized by your cells of your body that utilize enzymes. In a particular case, we're talking about your immune system cells, your white blood cells. That's a great formula also that can be used with the Bill formula as a digestive and the VSCLR between meals when you have a lot of fat that is not only being digested with your meal, but is also maybe getting into your circulation and affecting maybe the normal level of triglycerides. So that will help digest fat in the digestive tract and systemically. You could also use that with a formula we're going to also talk about, the SKN formula, which is a skin formula, and I'll go into detail with that in a minute. For people that maybe have trouble digesting fat and also have a increased stress from maybe hormones that have escalated in the body because of transitions in age where we go through an increase of hormones, and maybe you need that extra processing of fat. So let's move on to the next formula. MSCLR, we call it muscular. MSCLR is a formula that has a lot of amylase in it. It has cellulase and it has catalase. Now, let's talk about that for a minute. Allergens in the body can ride on polysaccharides and polypeptides. So large carbohydrate molecules and large protein molecules. So when we're looking at them riding on polysaccharides, you might think that cellulase, which breaks down cellulose, might be something that breaks that down a little further. And maybe amylase breaks down the carbohydrates even further, so that if an antigen that rides on a polysaccharide is initiating a response for triggering the IgE antibody to initiate the mast cells, which then release the histamine reaction, maybe you can reduce the overdose of histamine release just by supporting healthy function, just by helping digest something that should have been digested in the diet, that should have been reduced in the diet first of all, and then should have been digested with enzymes that you added to your diet. But sometimes the body gets overwhelmed and it has a reactive response that maybe show up in your skin. So when you think of some kind of reactive response because the body is overwhelmed, especially when it comes to the skin, you might want to think about using the MSCLR between meals. Sometimes 2 capsules will do it. It also works well with that product that we talked about last time, the GMH3. There's a similar amount of amylase in both of those formulas. But one thing great about this formula, it has herbs in there to support the blood circulation to the skin. So think about a reactive response and a need for increased blood supply. Remember I said angiogenesis. We need blood supply. You need oxygen. You need nutrients delivered to the tissues to do what they're supposed to do. And that's all about giving the body what it needs. Make sure it has enough energy. Make sure it has enough enzymes. So this particular formula works well with a kidney formula, which we call KDY, which we're going to talk about shortly. It works well with a liver formula, which we're also going to talk about because the liver needs to process things, and I'll wait to talk about that. And maybe the skin needs some support with vitamin C, and so it works good with the OPT formula, and we'll be talking about that in the next webinar when we talk about the control system with the autonomic nervous system and the endocrine system. Also, I want to mention with this formula is it has catalase in there. Now, cells produce hydrogen peroxide, all cells do, in the process of metabolizing and creating the energy. Remember, every cell needs energy. So the energy of aerobic metabolism results in the production of hydrogen peroxides, which, if it's not cleaned up, can actually kill the cell. So the catalase in this particular formula will help adjunct the catalase that the cell produces to clean up the hydrogen peroxide, which can act as a free radical. Now, there are studies done in the early or late 20s, early 30s, where they found that certain virulent bacteria have a lot of catalase in it, and they believe that when a bacteria was interfering with a cell function, it was the cell with the most catalase that won the battle. So when you think about healthy function, you think about supporting and giving the body what it needs to do its normal job. Catalase is an important enzyme to think about, and it's in that formula. Let's go on to the next formula. TRMA, trauma, that is a proteolytic formula. Now remember the white blood cells, they have lipase in there, they have protease in there, they have amylase in there. The white blood cells use a lot of protease. So think about what the body is trying to do when something comes into the system. When something comes into the system, that it could be a bacteria or a virus. You know, if you think about what they're made of proteins and fats, mostly. So when you think about how is the body taking care of itself? So I know there's a lot of fear about what's going on right now and all the things that are happening, and certainly if there's a chronic condition related to this virus, then absolutely seek medical attention. Do not hesitate. But can you support the healthy function of the body? Can you give it the adjunct enzymes and food nutrients that it needs? Absolutely, certainly you can. And that's the only thing you can do. You can't treat disease. You can't do any of that. Nutrition is there to support healthy function. So remember that. And also remember that if a person is on medications and you're thinking about putting them on supplements, you need to have them check with their medical doctor. Don't just assume that you can give it to them. If you have any questions at all, don't hesitate. That's important to remember. Now, let's look at the TRMA formula. It also has catalase in there. Again, we just learned about catalase and its importance. And we also think about TRMA for more of an acute reactive response, because in an acute situation, the body is more alkaline, and the body needs protease in a more alkaline situation. Now, this TRMA works with a lot of different things. I know last time we talked about SVG as a product that helps put in complex carbohydrates. And we also talked about it helping the flow of saliva. So if something happened in the throat and you had a reactive response, which could be redness or pain or anything that would be reactive or some kind of swelling, you could use TRMA with that. You can use it with something that maybe happens in the urinary tract and there's an irritation there that maybe got cultured, and maybe you're looking at giving the white blood cells the added protease. That would be a good thing to add. And so think of it as a formula that has proteolytic enzymes in there that is going to help the white blood cells in their use, in their application of protease, in the white blood cells' intelligence to know what to do with the protease. Always think that way. That's why when you think of healthy function, you're thinking about supporting the body's normal mechanisms. You're not going after symptoms. What you're doing is, and I call symptoms, as I told you before, a reactive response. You're going after giving the body what it needs so it can minimize reactive response. Are there times when the reactive response gets out of hand and you need to refer? Do not hesitate, refer. So let's look at the next formula. Next formula is called OSTEO. When we think about that formula, we think about joints, think about skin, think about nails, things that require sulfur for its healthy function. The skin requires sulfur. The joints require sulfur to heal and to return to their normal functioning, optimal response. But it also has, lipase in there and protease in there and amylase in there. So it has enzymes in there. The enzymes are there to support the healthy function of the immune system that use those enzymes so that the joints are trying to heal, and maybe there's a reactive response of pain or swelling or something that needs the adjunct enzymes. It's built into the formula along with the sulfur that will help feed the joints. So think about it that way. Let's move on to Zinmin. Now, over 300 enzymes in the body require zinc for their healthy function. Remember, enzymes require a cofactor, vitamins and minerals, for the enzymes to be active, for the enzymes to do their job. Zinmin has a lot of zinc in there, but it has other minerals in there as well. So sometimes when you think of reactive response, a reactive response with a deficiency of zinc might be somebody's stinky feet. Well, maybe it's a reactive response that you're being affected by someone else's lack of zinc. But also, if you lack zinc, zinc can also affect your sense of taste and your sense of smell. So if someone has a lack of zinc and produces something that's not pleasant, you better hope that you have one too. But if you both take the Zinmin, maybe you can both correct the situation and have a happier lifestyle. Anyway, that's a great formula. And again, all of these formulas I'm talking about that support autointoxication, which is part of the immune response, are taken between meals because you want to get it in the time, like I said, where you're not using it to digest your food, you're using it for its absorbability factor to the white blood cells and those cells that are designed to do their job. Let's talk about the next one, SPL. Now we're looking at immune supportive or nutritive formulas. Remember I said last time that we have a nutrient priority sequence built into our formulas, and that the macronutrients and the micronutrients cannot be utilized unless the macronutrients are digested and absorbed. Well, we put enzymes right in the capsule to digest these herbs and substances that are in here that are normally used to support the spleen. Now let's look at the spleen, for example. SPL feeds nutrition to the spleen. Why do we need the spleen? Well, the spleen produces antibodies, it produces platelets, it produces new lymphocytes. Remember, lymphocytes have enzymes. It also removes and repairs and gets rid of old red blood cells and puts new ones in there. It works in conjunction with the bone marrow to have the macrophages produced. So it's a very powerful organ that really is there to support the blood. It's also a formula that has iron in it, in the herbs, and iron is needed to feed the hemoglobin so that the hemoglobin can carry oxygen, because remember, the body needs oxygen to help the process of aerobic metabolism, which produces a lot more ATP for energy. Remember again, the body is needing energy. That is the thing that it needs for the organ systems to do their job. So in this particular case, you're looking at supporting the function of the spleen by putting in the adjunct nutrients with the enzymes to digest them so that we can maximize the usability of these nutrients to feed the spleen, to oxygenate the blood, to provide what it needs with the blood components, the macrophages, the white blood cells, the platelets, all of that. That's what the spleen does. Usually it's given to after the meal. And I mentioned a general great protocol. Remember I said use vascular VSCLR as a digestive in this particular case. Use the SPL at the end of the meal to support the function of the spleen. And then we talked about trauma and using that between meals to provide the protease and the catalase to help the white blood cells do their job and optimize their normal function. Let's move to the next formula. Next formula, LVR. LVR is a formula that helps and provides nutrients, hematinic, meaning feeding nutrition to the liver, and the liver is going to clean the blood. The liver is designed to support, to clean toxins that are in the body. The liver is the LVR is a great formula because the liver has the function of releasing bile, which helps emulsify fats. It detoxifies substances. It is responsible for the majority of the body's metabolic systems, producing enough glucose, producing enough taking amino acids and converting them to glucose, taking fatty acids, converting them. It also has what they call Kupffer cells that are in the liver that are surrounded with white blood cells that are designed to clean things up. This particular formula is helpful in what we call phase 2 of liver detoxification, where water-soluble substances and free radicals are cleaned up. When I talked about the SPL, I also want to mention that supportive formula for the spleen is really a supportive formula to support, well, that formula, of course, we talked about it supporting the spleen. I'm jumping a little ahead of myself here. We're going to talk about the SKN formula for phase 1. But let's do that next. But before we do that, I want to talk about the kidney. Now, the kidney, the KDY formula, is a formula that supports the function of the kidney. Now, the kidney could have a reactive response when it's overwhelmed. So things coming out of the liver are going to go to the kidney for the kidney to clean the blood even further. So after things are taking out as much as possible. Now, one of the things that the liver can't process is phenols, but the kidney can. So the kidney might have to get rid of those. Okay, the kidney may have to balance the electrolytes so that you balance your pH level. Maybe the body needs to be tipped a little more acidically, maybe more towards alkalinity. Well, the kidney is responsible for that, along with breathing. Of course, we talked about that last time, breathing and oxygen versus carbon dioxide. That affects your pH also. But the kidney is a big one for cleaning the blood, but also for balancing pH, for also regulating blood pressure, Because remember, we need a good blood supply. That's what angiogenesis is about, and bringing nutrition to the cells. So it's the cells are oxygenated, the cells have the nutrients they need. All of that is important. The kidney is a great supportive formula. Usually you could take it 2 after meals. You could also take 3 between meals. So if the kidneys are overloaded, think of a reactive response of nausea. When the body is overwhelmed and the kidney's not doing its job, you may get that reactive response. So when you're supporting, back to the liver, when you're supporting the function of the liver, now we're going to talk about this SKN formula, a skin formula. That is a formula that also will feed the skin, but also supports phase 1 of liver detoxification. Phase 1 is where it takes fat-soluble substances and converts it to water-soluble. Now, we talked about the LVR formula, taking it from water-soluble and cleaning up free radicals. This particular formula will take the fats that are overwhelming the liver and support the liver's function in that regard. So take, for example, if you're looking at someone that has an increase in their hormones, and maybe the liver has a lot more fatty-based molecules to deal with, then you're looking at supporting the liver so the liver could process those fats. So think about what would you use for a digestive in that particular state. Maybe you would use vascular VSCLR, which has a lot of lipase. Maybe you'd use the BIL formula, which also has a lot of lipase and protease. So think in terms of, go back to, here's a person that comes in to see you. Here's a person that you realize needs to change their lifestyle because they're overwhelming the body. So now you're looking at putting them on a healthy diet. Then we talked about looking at digesting that diet. We looked at it from the perspective of cleaning up the bowels so that it's not overwhelming the lining where the immune system starts its guard. And now we're looking at what is left for the organs of the immune system to do their part to reduce the overload, which then leads to a reactive response. So if someone has a skin condition, again, you want to think in terms of healthy function. What does the skin need? Does the skin need a nutrient? We talked about a supplement to feed fatty acids, because fatty acids feeds the skin and the nervous system. We talked about that last time using the sore ribs formula. Maybe there is something to pay attention to, or maybe the liver is overwhelmed, and maybe it's overwhelming the system to the point where the kidney can't handle it, and it's coming out through the skin. So you have to think about what organ system in the cascade of maintaining homeostasis, what organ system needs the support, and what order do you need to think about? It's all, and that's how you think through these processes, because, you know, there's a lot of you on this call that have learned a objective way of evaluating the body. Absolutely, that is very powerful, and that is your tool. But in order to really think about where to go and look, you need to understand the functioning of the body, and that's why we created this system of focusing on healthy function. Because the more you understand what the body is trying to do, the more able you are in explaining that to the clients and patients that come to see you, and explaining why is it that my body is exhibiting this reactive response. So you explain to them, you need to change your diet. You need to digest your food. It's because this particular organ system is not having the energy that it normally needs to provide its part in maintaining homeostatic balance around each and every cell. We're a multifaceted organism that has a lot of cells it needs to take care of, and it needs to have the coordinated effort of all those healthy function organ systems. That's why we created that booklet for you. and you can see the link in the notes. You can click on that particular organ system. You can read about its function. You can read about the diet that helps it and the nutrients that helps it best, because that's where the decision starts, right there. That's an important thing to remember. So let's go to the next formula. URT. Maybe it stands for urinary tract. So the urinary tract, when we think about that, that still has exposure to the external environment. Let's say you're eating a diet of too much coffee. Now, coffee is acid, but it has an alkalizing effect. And when you drink a lot of coffee, it can create an irritation in the lining of your urinary tract. Let's say you eat too much sugar. Sugar can create an irritation where it's more of an acidic response, which also can irritate the lining of the urinary tract. So a lot of people that complain of urinary tract complaints, maybe it's just because you need to change their diet and get them off to coffee or get them off to sugar. So if there is a little more involved, and maybe there is a culture involved that shows that they need an antibiotic, well, you can help the healthy function by using that particular formula in conjunction with the TRMA formula, which is going to provide proteolytic enzymes to feed the white blood cells that have an intelligence to do their part. You may still need the antibiotic, but the question is, are you, as a nutritive focused practitioner, focusing on healthy function? Remember, if it's chronic, refer, but focus on health. Focus on what you can do to help everyone that comes in by providing the best advice to give them to do their part, in taking control. Fear is about realizing that you're not in control and you're fearful, and then you're going to trust someone else's advice to do what's right for you. Well, your body has an intelligence. It knows what to do. There's no question. It's up to you to understand healthy function to the point that you feel comfortable recommending something that's logical, that makes sense, that gives them the encouragement to take charge of their own health. That's what we want to do. We want to give people the tools to take care of themselves. Anything that shows up in our environment that is stressful to the body, anything that shows up is going to stress healthy, normal function. You can't use nutrition to go after something in the environment, but you can use nutrition to support the body's brilliant functioning system to do its part. And that's the best thing you could do for your clients, the people that come to see you, your families, yourself. Use the tools that you have. Use the intelligence of the body to do its part, and use your intelligence to understand healthy function well enough to help in the best way you could possibly help. Thank you for listening today. I'm sure we're going to have some questions. We will put that slide up in a minute. I write your questions. We're going to go to that. I am here for you. Please reach out to me. So, I'm here to support you. We are here to support you. We work very hard to put these things together, and we're very happy to help you every step of the way. Thank you again, and I look forward to answering your questions. All right, everyone, let's look at your questions here. What is the difference between VSCLR and VSCLR plus? Well, we had so much response with VSCLR plus that we made the old vascular and replaced it with the VSCLR plus. Okay, next question. How many vasculars between meals, and can it be given with other enzymes? Well, certainly you can give with other enzymes. You know, I would trust your objective findings. Between meals, 3 is usually a good protocol. You could even go 4 if you needed to. Again, trust your clinical judgment on that. And again, remember, between meals is an hour before you eat or 2 hours after you eat. I have patients who have shellfish allergies. Is there another option for patients who have joint issues? Well, that is a very good question. If they have a shell allergy, yes, there is a concern with using the osteo formula. I agree with that. You want to make sure they get sulfur, so you might want to supplement with some other chondroitin sulfate or organic MSM sulfur. You can also use possibly HCl. It's a formula that has beet in it, which is high in sulfur. Maybe not systemically, but digestively. But somehow you need to get sulfur into the mix. Okay. What is phase 1 of liver detox? Phase 1 is where the liver takes fat-soluble substances and converts it to water-soluble. Remember, I talked about phase 2 takes those water-soluble substances and converts it to free radicals and cleans up the free radicals. Next question. If a client test shows acid and they are taking enzymes that address their healthy function, if they get an acute or their body shifts into alkaline for that time, is it okay to give trauma without making them more acid? Okay, look at it this way. Usually when things have been going on for a while and you're becoming more acidic, there's usually a new process going on that's alkaline. You still need to support the white blood cells, which are providing enzymes when you want to enhance their healthy function. So certainly you can use trauma. It's not going to make them more acidic. It's going to help the white blood cells do their job. Next question. If you give Bill and they need vascular and muscular, can you give muscular and vascular between meals together? You certainly could. You certainly could. I would use your clinical judgments to see how much. Those of you that have objective means of evaluating the body based on neurological connections of muscle groups to interorgans, you certainly can use your skills that way to determine the amount. But you certainly could give both. Can the skin be overwhelmed by both the liver and the kidneys? I have seen many rashes lately, and some do not respond to working with the liver. Thank you. All right, you have to look at this. Yes. Can they be overwhelmed? Yes. The reason why it's coming out through the skin is because they are overwhelmed. But you have to look at, okay, I'll support the liver, I'll support the kidneys. Maybe they're still having a reactive response. Maybe the skin needs an adjunct nutrient to feed the skin itself. Maybe you need that macronutrient that we talked about in webinar 1, which is called sore ribs. Maybe you need that borage oil with lecithin to help feed the skin. There could be your problem. Maybe you need to clean the colon, which is overloading the liver and then putting extra stress on the kidney. So think upstream, think about diet, think about what's overwhelming that diet. Maybe you need to look at what it is they're putting in their mouth that creates that whole scenario, because I guarantee you there's something from starting from diet to digestion and bowel elimination that's overloading the kidney and the liver. Let's see. Okay, let's see. I don't see anything else. If there's any more questions, please submit them. I know we're about 15 minutes earlier from being done, so if you want other questions answered, I do not see any more on my screen. So I want to thank you for everything that you have done to help your people. I want to remind you again that I am here for you. And if you have any questions and your questions have not been answered because you decided not to type them in the question and answer section, you can call me. I am raring to go here. I love this work. I've loved it for many years, and I am here to help you to understand the healthy functional choices so you can make the best decisions and help as many people as you possibly can. So I guess without further ado, and since I don't see any more questions, we are going to be complete for today. So have a great day, stay safe, keep your family and yourselves healthy, and stay positive. Thank you very much.